Researchers are warning that the growing threat of antibiotic resistance is making common infections more difficult to treat and putting medical procedures at risk. A new study published in The Lancet predicts that nearly 40 million people could die from antibiotic-resistant infections by 2050. The study found that deaths due to antibiotic resistance have been steadily increasing and are expected to accelerate in the coming decades. The World Health Organization has called antimicrobial resistance, AMR, one of the top global public health and development threats, driven by the misuse and overuse of antimicrobial medications in humans, animals, and plants, which can help pathogens develop a resistance to them. Antimicrobial resistance happens when pathogens like bacteria and fungi develop the ability to evade the medications used to kill them. It's a big problem, and it is here to stay. Researchers are warning that the growing threat of antibiotic resistance is making common infections more difficult to treat and putting medical procedures at risk. Their findings reveal that older adults are disproportionately affected by AMR deaths, facing a higher risk of infection. The study analyzed 520 million data points, including hospital discharge records, insurance claims, and death certificates from 204 countries. Through statistical modeling, the authors discovered that over 1 million deaths related to antimicrobial resistance occurred annually between 1990 and 2021. They predict that AMR deaths will continue to rise. Researchers noted that the projected 39 million deaths over the next 25 years would average about 3 deaths per minute. The researchers from the Global Research on Antimicrobial Resistance Project, the Institute for Health Metrics and Evaluation, and other institutions estimated deaths and illnesses attributable to versus associated with antimicrobial resistance for 22 pathogens, 84 pathogen drug combinations, and 11 infections across 204 countries and territories from 1990 through 2021. A death attributable to antimicrobial resistance was directly caused by it, while a death associated with a MR may have another cause that was exacerbated by the antimicrobial resistance. The study also shows an uneven burden. While MR deaths among children under 5 decreased by more than 50% from 1990 to 2021, deaths among individuals aged 70 and older increased by over 80%. The researchers expect deaths among children to continue declining, having by 2050, while those among seniors are projected to double in the same period. This shift could lead to MR deaths among older adults, surpassing those in other age groups as the global population ages and becomes more susceptible to infections. South Asia is projected to account for an estimated 11.8 million of the 39 million AMR deaths, with significant numbers also expected in sub-Saharan Africa. Scientists emphasize the role of antibiotic overuse and misuse in driving bacterial resistance. They advocate for improved antibiotic stewardship to enhance access to antibiotics while controlling their excessive use. Researchers emphasizes the importance of avoiding unnecessary antibiotic prescriptions. The study calls for increased efforts to combat antibiotic resistance, including improving antibiotic stewardship, promoting infection prevention, and developing new antibiotics. By taking these steps, we can reduce the number of deaths caused by this serious public health threat. The innovative and collaborative approach to this study provides a comprehensive assessment of antimicrobial resistance and its potential burden on the world. Thank you for watching. If you've enjoyed our videos, subscribe to our channel for there's more to come.